Affordable Medicare Solutions is Georgia's leading provider of Medicare education services. Hello, everyone. Thanks for joining us for this informational video, educational video on Medicare, soup to nuts. We're going to talk to you about what it means to enroll in Medicare and to manage your Medicare, which is very important. Medicare is not set it and forget it. My name is Keith Knabb. I'm the owner and founder of Affordable Medicare Solutions. We are Georgia's leading provider for Medicare education services, and we serve all of the state of Georgia, plus we serve most all of the United States. So just give us a call and we'll take care of any Medicare question you have. If we can't help you, we'll point you in the right direction, I promise. Let's get to it. Let's learn about Medicare now. This is the 2024 Clear Guide to Medicare from Affordable Medicare Solutions. For compliance, I want you to understand that this presentation is for educational purposes only. We are not employed by Medicare. We do all of this as a public service, and you can get great information at the federal website, medicare.gov. Never go to medicare.com. They'll try to sell you something. Be careful. No plan names or companies or prices will be shared today. We've got great additional educational flyers available at our website, www.amsplans.com. This will also be mentioned at the end of our video. And we also have a great YouTube channel. So you can click right onto our YouTube channel to see videos like this one, as well as other shorter videos on different subjects that impact Medicare, drug prices, and your income. Today's topics, we're going to talk about the history of Medicare, Medicare modernization, what does that mean? Prescription drug improvements, good stuff on the way. Modern innovations. Is the government really innovating? Yes, they are. Some things are good that are happening. Management periods. What does it mean to manage your Medicare? And what does Medicare not cover? Because Medicare cannot cover everything. And what are your personal next steps to make sure that you can manage your process, whether you're turning 65 or you're retiring or you have some other situation coming up in your life? So who is AMS? We're Affordable Medicare Solutions. With 29 years of service, we are a dedicated team of 11 professionals who believe in taking an educational approach to helping seniors and loved ones find the best Medicare plans for their needs. Not just once, but on an ongoing basis. We represent the client, not the insurance companies, and all of our services are free. There's no charge to work with us. We're paid by the plans on your behalf, and our agency serves all of Georgia and is the most award-winning agency in Georgia. And we have over 500 five-star reviews. So let's get to the meat of the matter. The meat of the matter is back in 1965, seniors did not have health care at retirement. That's crazy, but they do now. Medicare was born, but the same year, another program called Medicaid was born. Sometimes people confuse those terms. Medicare is for everybody. Medicaid is generally for the low-income people, and you can have Medicare and Medicaid together. That's fine. You can have Medicare alongside your work insurance at your job. You can have Medicare alongside your veterans benefits, but you cannot have Medicare alongside your Affordable Care Act health insurance. So if you're under Obamacare, individual personal health insurance, you got to leave that, go into Medicare. So who's eligible for this great program from the government? It is known generally that people who are 65 and older get Medicare. That means you've been working and paying your taxes. Maybe your spouse wasn't working, but he or she would qualify under your work history. And you say, yeah, I want Medicare when I'm 65 years old. But some people raise their hands and say, well, wait a minute. What about Bob? Bob got hurt at the factory. He's only 57 years old. What's going to happen to Bob? Well, they created a program called Social Security Disability Income to give Bob, enough money, hopefully, to put bread on his table and a roof over his head, barely. And they said, if he's disabled for 2 years, we're going to give him Medicare. And that's kind of cruel to think somebody's disabled, they're going to go 2 years with no health insurance. So there's different ways we can get that person health insurance, but Medicare said we're going to be a 2-year wait for that person. And some other people raised their hands and said, well, wait a minute, Bob didn't get hurt at the factory. Bob's got Lou Gehrig's disease, or Bob got, kidney failure and he needs dialysis. So the government said, yeah, you're right. We're going to create a third level of eligibility for people who are in these dire circumstances that need health care. If they don't get it, they're going to die. You need dialysis to survive until you get your kidney transplant. So the government is all the time looking at ways of improving this eligibility for Medicare, but it generally is people turning 65 or losing their group health insurance, or if they're disabled. So the foundations of Medicare are different than any other healthcare system, because remember, it was created in the 1960s. My dad's a retired doctor, and he's told me that used to be everybody would go to the hospital for all of your services, for your lab work, for your x-rays, for all of your testing, your exploratory surgery, or other things. And so Medicare put all of its emphasis originally on hospitalization. That's called Part A of Medicare. And there's no charge. They say, we want to give people the primary coverage for free. Well, that has completely changed for the last 50 years. Now, more than half of Medicare spending is outpatient. You don't go to the hospital for lab work. You just go to your doctor's office, or you don't do exploratory surgery. You get an MRI. You don't go get cancer treatment at the hospital. You just get cancer treatment at the oncology center. So outpatient care is way more important, and that's where Medicare has a premium. In 2024, it's $174.70 per month. So you have to pay that premium in order to participate in Medicare, but Part A of Medicare is no charge if you paid your taxes for 10 years. So when Medicare decided to finally modernize from 1965 until 2005, it did not modernize. Every other health plan in America did modernize during that time period. Medicare said, we're late to the game. We've got to quickly modernize Medicare. So they decided to roll out versatile new options. Pay attention to that word option, to allow people to creatively customize their Medicare, but it's not mandatory. And the government was very careful about this because they knew they had 25 million seniors already in Medicare in 2005, and they didn't want to tick off a bunch of voters. So they said to people, if you like your existing Medicare, it's okay, you can just keep that. But if you want to try out new sides of Medicare, if you want to add drug coverage, if you want to improve your plan, you can. Nobody's going to force you to. So that created a 2-channel system. Pathway number 1 is traditional classic Medicare. We love it. Pathway number 2 is this new modernizing effort. And Medicare decided to gently modernize over 20 years. Actually, now it's going to be over 25 years. And they are very, very careful to not do what happened under the Affordable Care Act. Under the Affordable Care Act, they tried to change everything overnight, and that caused a lot of problems. Medicare has been doing this very gently. So let's talk about when the government was not modernizing Medicare back in the 1970s and 1980s. The insurance companies heard people complaining, saying, hey, Medicare doesn't cover everything. Why don't we sell people little insurance policies that fill in the gaps of Medicare? And they nickname these little supplemental policies Medigap plans. So if you hear a Medicare supplement or Medigap, those are interchangeable terms. And that just means that you're buying a little insurance policy that rides on top of Medicare to help fill in the holes. So you have your red, white, and blue Medicare card, and then they made a mistake. In the 1980s, they said, we're going to standardize these little supplements that have been, cropping up like mushrooms all over the United States, and we're going to make them consistent. And they said, we're going to use letter codes on these new insurance policies, A, B, C, D, E, F, G. They shouldn't have done that because that made Medicare confusing right away. You have your Part A and Part B card, and then some insurance agent saying, hey, you need another Part B to get this Medicare supplement. People are like, well, I already have Part B. It's a different. They should have used Roman numerals or something else rather than letters. So you have your Medicare card, your supplemental card, and now you have a Part D drug card. as your third card. So no other healthcare system is this way. Traditional Medicare means you carry 3 cards with you. Works really well, surprisingly, very well, but it's confusing, and we help people understand the differences. When the government said we're going to modernize Medicare, they wanted to get away from that system of multiple cards. So they created a one card ID system, very similar to what you have at your work. You have your health plan ID. I've got coverage from my job. Well, under Medicare, same thing, but you still have to pay for your Medicare Part B. Part A is included, hospital. Part B, you have to pay the $174.70, and you have a single ID card that almost always includes your drug coverage. You can opt out of that if you want, and extra coverage. So when you hear on TV, get your extra Medicare benefits, they're talking about this new side of Medicare where they've got lots of robust extra benefits. So this side of Medicare is from insurance companies, and they utilize networks. HMO means mandatory network. PPO means open and flexible network where you can go either in the network or out of the network. Very important. Well, half the people in America now are using traditional Medicare, and the government announced now that it's over 50%, I think it's 51% as of the time of this video, that are actually using the new side of Medicare. So we have a balanced system. Half of people, that's fine, I love it, use traditional Medicare, and half use the new side. Neither one of these sides of Medicare are going away. This river is flowing. Let me help you to understand which one would be the proper place for you to put your family, yourself. People get over analytical on this, and I like to bring this down to a much easier way to understand the three most important things you have to look at. And there's a lot of differences, but this is Medicare supplements versus Medicare Advantage plans. The top line, SUP, there is describing supplements, and the bottom line, ADV, is describing Advantage plans. So this is really important. The first column is what doctor can I see? The second column is what the heck is this going to cost me out of my monthly budget, and can I afford it? And the third column is what the heck is it going to cost me when I get sick to get better? Is it going to cost me nothing, or is it going to cost me $5,000? And then if you look at the left-hand side of the screen, it says prepay or pay as you go. Think about it this way. Your grandmother taught you this, your dad taught you this, your mom did. There's no such thing as a free lunch. You either pay now or pay later. With a Medicare supplement, it is an insurance policy where you prepay for your medical care. You send your money off to an insurance company, and they're required, they don't have a choice, they're required to pick up your Medicare approved bills. If you use an Advantage plan, you generally don't pay a monthly premium. And when you need care is when you pay a copay, not deductibles, but a copay to take care of your medical bills. So I want to use myself as a perfect example. I don't qualify for Medicare. I'm 57 years old, and I have an Affordable Care Act, quote unquote, Affordable Care Act medical plan with an $8,000 deductible. I broke my ankle. I had to write a check for $8,000 before they would schedule my ankle surgery. I had a very small list of doctors to choose from on that surgery. Luckily, I had a good doctor, did a great job. But that's crazy. On top of all of that, I have to pay $700 a month for my insurance. Not a good deal at all. Let me tell you, these Medicare plans are a much better deal than what I'm paying for. For example, under a Medicare supplement, you can go to any doctor who accepts Medicare nationwide if they're willing to see you. Under a supplement, yes, they might be quote unquote expensive, maybe $150 to $200 a month, and you buy a drug plan for $10 to maybe $30 a month for your drug plan. That's fine. That's better than $700 a month that I'm paying. And then you go in for your surgery, and almost everything is 100% covered. You might have a small deductible next year, maybe $240, but it's no big deal. The supplement is super flexible. No changes nationwide. You can use it very well. All the hospitals practically take it. Really, really simple, clean, easy coverage. Now, the Advantage plans are great plans, fantastic options. But this is where you will need to choose your doctor from a network to get the best deal. HMO means mandatory, network PPO means flexible, open access. And generally, the PPO networks are nationwide. Also, you might even have international coverage. These Advantage plans almost always, more than 90%, are a zero monthly premium. And people say, well, wait a minute. How is something $0 per month? No, you still have to pay your $174.70. You have to pay that. And if you go in for services on the third column, you're going to pay a copay. So there's nothing free. You have to pay. So if you go to the emergency room, it might cost you $100 for the emergency room. Well, the emergency room bill might be $5,000, but you only paid $100 copay. There's no deductibles generally. Let's say you go to the hospital and you're there for one night. It might be $350 or $400 for one night. The hospital bill might be $20,000, but you just pay a small copay. But the Advantage plans are the one place in Medicare where they say, look, we're going to protect you with an out-of-pocket maximum rule. Some plans have a $3,000 or $4,000 annual cap on your risk, that you're not going to get any bills more than that. Some plans have $8,000 or $9,000. So you have to be very careful when you shop on these plans that you find a plan that does not threaten your finances. Don't get excited about any plan, though. We're going to teach you how to find a right plan, but don't get excited about them until you find out what the star rating is. A few plans get 1 or 2 stars, and you generally want to steer clear of those. We had one here in Georgia this year that got sanctioned for bad policies and performance. Most plans are 3 to 4 stars, which means average or above average, and that's fine. And then every now and then we get a 5-star plan, which is excellent. And they get special privileges. They can enroll people year round, and they're just getting extra bonuses for Medicare and everything. Well, if a plan is 4.5 stars, they're getting a bonus, 3.5 stars, etc. So the plans really strive to hit these star ratings, which means quality ratings. Next up, we're going to talk about drugs. But before I go to our next slides, I want to let you know, if you already want to talk to an agent, you want to figure out, hey, Keith, I know you guys know what you're talking about. Just tell me, take my drug information, my doctor information, and my pharmacy, find me the right plan. You can go ahead and contact us at amsplans.com. At the end of this video is also our contact information. You can email us at info@amsplans.com, or you can call us at 770-945-5261. Now let's talk about prescription drug prices. It's amazing to think that seniors did not have drug coverage until 2005. The most modern country in the world was not paying for drugs for our seniors until 2005. Kind of crazy. And when the government built this program, they were worried that it might sink the federal budget. So they put in all sorts of weirdness into this program, and it's going to be changing in 2024 and 2025. We're seeing big changes. So don't really take all of this to heart yet, because the government hasn't even told us exactly how the plans are going to look in 2025, but we know what they're going to look like in 2024. Some plans can have a deductible. Every single plan has an initial bucket of money of $5,030 for you to cover your initial allotment of drugs. And then after that point, you have to pay 25% of the cost of your drugs. I know, kind of crazy, but that's the way they set it up. But look at this. The worst case out of your pocket next year in 2024, this year, is $8,000. That's crazy. In 2025, it's going way down. We're going to cover that in just a second. After that $8,000, we used to have to tell people an unfortunate thing, that they had to pay more money. Not anymore. The government improved it. Once you spend the $8,000, 100% of your drugs are going to be covered. So I know a lot of insurance agents that can't even explain this screen. Don't worry, there's no test. I'm going to show you the easy way to figure out your drug prices. So let's make it easy. You can actually find your right drug program, Part D of Medicare. By going to Medicare.gov, there's about 20 drug plans per county, but only about 3 to 5 actually cover your pharmacy and your list of drugs. So why look at the other 20 plans? So it's pretty simple. You go to Medicare.gov during the annual review period or before you're turning on your Medicare, and you say, these are the drugs I'm taking. If you're already in Medicare, they're already listed in your account. You can just check off the boxes and put in your pharmacy, put in maybe 2 pharmacies if you want to compare prices, and you hit go. And it says you're on the wrong plan. The average person is wasting $1,000 per year by being on the wrong Medicare drug program. And $1,000 out of your pocket is $1,000 in the pocket of the insurance company. So don't give away your money. High income earners are going to pay extra. They're always targeting high income people to pay extra taxes. And there's a surcharge under Medicare Part D. Low income people don't have to pay that penalty. Low income people get lots of help. They get extra help. Low income people get premium support, $33 to $44 per month will be given as assistance to them to pay for their drug plan. And if they qualify, if they're low enough income, they will also say, hey, you don't have to worry about paying any big dollars for your drugs. You might only pay $4 or $10 for your prescriptions, maybe $11. They're going to protect them from high drug costs. And also they don't have to worry about any of the rigmarole of the $8,000 out of pocket or any of that stuff. Medicaid for the poor, Medicaid automatically qualifies a low income person for all of these extra benefits from the government. But still, we run across people that have high cost medications. I have a client who's taking a drug, a cancer drug, saving her life. It's $20,000 a month. She doesn't have to pay that. She's going to pay about $6,000 or $7,000 next year for her cancer drug. So she needs some help with that $6,000 or $7,000. So she's calling for patient assistance programs. These are really great programs that are sometimes from the manufacturer, sometimes from foundations or associations, and that'll provide people with help. You've got a lung problem, a kidney problem, cancer problem, a specific brain cancer, whatever. You can ask for different reimbursable funds to say, hey, I need help with my drug costs to keep me alive. Some of these programs are probably going to be revised or go away in 2025 when the government improves the Medicare drug program even more. But even so, on low-cost drugs, we'll have somebody that'll have a low-cost drug, generic, and it's like $6 a month. It's great. It's covered by the plan. And they say, hey, Keith, at Walmart, my drug's only $4, or at Publix, it's free, or I can find it through Cost Plus Drugs from Mark Cuban. That's okay. You can, if you find your drug cheaper on one of those programs, it's okay to use a coupon or a program. Just remember that Medicare does not give you credit when you buy drugs separately from Medicare. They don't give you credit towards your Medicare annual out-of-pocket limits. But it's okay. Don't let some pharmacist tell you that you can't do that. It's okay. If you want to use one of those programs, it's fine. So here's what I've been hinting at for the last couple of screens is the big improvements to prescription drugs under Medicare. So 2023, they started on July 1st that everybody under Medicare who's using insulin, including people that wear the insulin pumps, don't pay more than $35 a month for their insulin. This is brilliant. Insulin should have been, next to nothing 20 years ago. We've been getting ripped off on the cost of insulin for a long time. The government has finally fixed this. And in 2024, they're going to actually increase the eligibility for what is called low income because of all the inflation that the government has caused. They're going to say, all right, we're going to raise what we consider low income by 10%. Inflation is running at about 10%. So they're going to do that to help out to get more people qualified for the low income subsidies. Now, in 2025 is the biggest issue. 2025, every plan, instead of having an $8,000 out-of-pocket maximum, will have just a $2,000 out-of-pocket maximum. That is a huge gift to seniors. Kind of creative how they did that in an election year, right? But it's really, really a big deal that some seniors are putting their drugs on their credit cards. They're now not going to be under the threat of an $8,000 out-of-pocket max. It's just $2,000. And then in 2026 through 2029, 60 drugs, the top 60 drugs that cost Medicare $50 billion a year, are going to be negotiated. They've already announced the first 10 drugs, some drugs such as Stelara, Eliquis, Jardiance, Xarelto, Farxiga. They're going to start negotiating those drug prices to get them down to help the seniors out. And that's a big deal. Go to the bottom of this page. It says through 24 through 2029, the drug premiums are limited to no more than 6% growth per year. Very, very good thing, because we saw some drug plans going from $50 a month this year to $100 a month. But remember, it's based upon the average national premium. So if you're on a drug program that's $20 a month, it could go up to the national average, which this year is $44. It could do that. But if a drug plan is $45, it can't go up more than 6%. This is a big deal. We've seen a lot of abuse under drug premiums, and that's one of the reasons why the average person is wasting $1,000 a year on their Medicare drug plan. So surprisingly, the government is encouraging innovations. There's been a lot of modern innovations in Medicare over the last 15 years. One that I kind of get a chuckle about is preventive care. Every health plan I've ever had in my life gives me an annual checkup. Medicare did not do that until 2011. Actually, they started testing it in 2005 under the new side of Medicare, the Medicare HMO and PPO side. And then in 2011, they said, this makes sense. Let's just give everybody in Medicare preventive care. Now, does Medicare pay for gym memberships, which is item number 2? No, but Medicare encourages the plans to have fitness programs. Most Medicare plans under the modern side of Medicare have a fitness component where they're going to encourage you to use the gym or some other fitness measures, almost always under the new side of Medicare. Traditional Medicare still doesn't do this very often. Medicare does not cover dental, vision care, like eyeglasses or hearing aids. President Biden wanted to expand dental, vision, and hearing to Medicare, but he failed on that. Congress wouldn't pass it. So there's an imbalance. The modern side of Medicare has great benefits under dental, vision, and hearing aids. And it's kind of unfair that regular Medicare doesn't have any benefit towards that. Number 3, expansion of at-home services. This really was a product of COVID. It started a little bit before COVID, but hey, once COVID hit, we needed to figure out how to give people health care at their home. Telehealth. You can actually talk to your doctor, your providers over the phone or the computer. Medicare used to not allow that. There's been an 8,000% growth in telehealth visits. Most of my own doctor visits are through telehealth. How about adult daycare? How about over-the-counter medical items like vitamins, sunscreen, Band-Aids, cough syrup, allergy medicines? Medicare doesn't cover that, but Medicare is now allowing the new side of Medicare to experiment with providing those benefits. How about groceries? You know, my dad's got plenty of money, but my dad's like, hey, if they're going to give me $75 worth of free groceries, I'll take it. You can't buy Oreos or lottery tickets, but you can buy milk, bread, cheese, eggs, vegetables, etc., because they want healthy diets. But how about home care assistance? Some Medicare plans have been testing providing people care at their home with, laundry, with taking care of errands, going to the grocery store, other things to make sure that those seniors are safe. Somebody is checking in on them to make sure that they're not having a medical emergency, etc. Medicare's never done that before, but they're testing out new at-home services. Now, item number 4 is what's going to save Medicare: chronic illness management and care coordination. Well, this is what's going to save Medicare because 5 people out of every 100 people, 5%, spend 50% of Medicare's dollars and Medicaid's dollars. So why don't we pay attention? And what we found out is that people that have 2 or more medical conditions, heart and lung problems, obesity and diabetes, or let's say high blood pressure and kidney problems, when you get 2 or more conditions called comorbidities, medical spending goes through the roof. So let's give extra attention to those people. And oftentimes, low income people have a problem where low income equals low health outcome. So let's target the chronically ill people and the low income people to keep them from sinking our Medicare boat. Let's give them extra benefits. Let's find out where we can help them so that they don't turn a $10,000 event into a $1 million event. Let's help them out. Medicare is finally paying attention under the new side of Medicare, not under traditional Medicare. Got to fix that. Now, let's talk about managing your Medicare. Managing your Medicare means you choose a different enrollment period that applies to you. If you're turning 65, that's the initial time that you're eligible and ready to get Medicare. Maybe not. Maybe you say, no, I got a job with benefits. I don't want Medicare. But you have the opportunity when you're turning 65, 3 months prior to your birthday month, in your birthday month, and then 3 months after, to sign up for Medicare. That's your initial period. Everybody gets that. Special election period is oftentimes more important because special election period means I'm leaving my job with benefits and I need to activate Medicare and I'm 70 years old, or I'm already in Medicare, but I'm moving from Georgia to Florida, or I've been affected by a flood, a snowstorm, a hurricane, and I need to change my Medicare. I've got something going on. Those are special election management periods, and they change all the time. If you call Medicare, they don't even know which ones apply to your county. We do, we know, because some counties don't get affected by a flood, but other counties do. Everybody was affected by COVID, so that was easy. But if it's a hurricane, maybe it's just Georgia and South Carolina or Florida. It might not be Tennessee. So we know which areas get affected by each circumstance, and you just call us and we'll tell you if that applies to you. Moving is one of the easiest ones, because then all you got to do is change your address at Social Security, and we can then manage your Medicare due to that address change. Now, everybody in Medicare, once you're in Medicare, also gets the annual election period. The annual election period is what we're in at the end of each year, October, November, December. December 7th it ends. Why would it end on December 7th? Because it gives them 3 weeks for the plans to process the last applications, print ID cards, and get them to people to use for January 1st. So remember, it ends on December 7th, starts on October 15th, but we actually get a preview on October 1st. So we actually start managing people's Medicare on October 1st. We find out if they're fine. If not, we say, okay, we're going to enroll you in a new plan starting October 15th and get you a new ID card for January 1st. That's the annual period. A lot of people have forgotten to do their annual reviews. Maybe they got sick or they just got busy. They had family in town, and they call me up in January and say, Keith, I've got a problem. I'm on a Medicare PPO and my doctor's not in there, or my hospital's not in my plan anymore, or my drug's not covered anymore. They used to be stuck for a whole year. Well, President Trump fixed this and said, all right, we're going to let people in January, February, and March choose a new plan if they're in the new side of Medicare. If they're under traditional Medicare, they're stuck. Maybe one day they'll fix that too. But right now we can help somebody who calls us and says, we've got a problem. I got a one-time mulligan that we can fix your problem, a do-over between January until all the way up till April 1st is the last effective date. And we get a lot of calls from nurses and social workers and families in those months to fix their Medicare. You can fix your Medicare Advantage plan during that time period. And if you wanted to leave Medicare Advantage and go to traditional Medicare, that's fine. We can change you off of your Medicare PPO onto a nice Medicare plan and get you a new drug plan also. But you can't just get a new drug plan if you're already in traditional Medicare. So there are some specific exclusions, and we know those rules. If you violate rules, you will get financial penalties. One of the most common violations is people get bad advice at their job and say, well, I'm leaving my job and my spouse is 63 years old and I'm 66. So we're going to take Cobra. Bad move. The older person should go into Medicare and the younger person should take Cobra as spouse only Cobra. But the HR department doesn't understand these things and they give out bad advice. You can create yourself a lifetime penalty under Part B, possibly even under Part D. And if you're high income, you also get a premium surcharge, an additional premium for your income being so high. Generally over $206,000 for a husband and wife, $103,000 for an individual. Low-income people don't pay these penalties. The government's not going to penalize the poor. Under the drug program, some people, even some relatives of mine, say, hey, Keith, I don't even take any drugs. I don't want drug coverage. And they wait 10 years and say, nope, I don't want to pay for the drug coverage. I don't need it, blah, blah, blah. And then 10 years later, they sign up for a drug plan. The government at that point is going to collect a penalty. It's about $4 a month for each year that you have delayed taking your drug plan. So if it's 10 years, that's a $40 per month penalty. Under Part B, which is the outpatient coverage, that's a pretty severe penalty. It's 10%. So this year, if it's $174, you'd pay $17.47 penalty the rest of your life if you screwed up and didn't take Part B when you were supposed to. So be careful. No reason to get these penalties. So how do you sign up for Medicare? Well, you don't sign up through Medicare, you sign up through Social Security. Social Security is the bill collector for Medicare. And people say, well, wait a minute, Keith, I'm not going to take Social Security until I'm 70. Why do I have to sign up for Medicare through Social Security? Because they're the bill collector. So when you sign up there at ssa.gov, they will mail you a bill that says, here's your Medicare premium bill. Quarterly bill. Now you can pay it monthly. You can pay it through an automatic bank debit if you want. It's your choice. But you want to do this online. If you're going to do this when you're turning 65, do it online and create your own login at ssa.gov, socialsecurity.gov, and create your login and click on sign up for Medicare. Do it 90 days out. The most you can do is 90 days out. Just give yourself plenty of time because it takes the government about 30 days to process your application. If there's an error on the application, you want to get some buffer in there time. And then the card, they mail you a paper, this is crazy, a paper ID card. Every other health plan in your life sends you a plastic ID card. Medicare still thinks it's right to send people a paper card. Go get it laminated. Don't have it be paper because that's your card. Get it laminated. And then that's at that point is when you can start planning the rest of your Medicare coverage, because that's just for your Part A and Part B. Now, if you're over 65 and you're leaving group health insurance and you're then activating Medicare, we have another video on our YouTube channel about leaving or losing employer coverage. Watch that video because it's a process different than what I just described for somebody who is 65, turning 65 years old. I know everybody feels like, wow, I'm the smartest Medicare expert ever. I've learned everything. No, you're never going to get all that in a 40-minute video, but I'm going to give you 10 more minutes of extra information because Medicare does not cover everything. If you want full dental coverage, talk to your dentist first. Do not ever buy a dental plan unless you factually confirm that your dentist is in network. And they will tell you, oh, we take that plan. No, I need to know if you're in my network. I don't want to know that you take my plan out of network. Critical events, number 2. Medicare covers heart attacks, strokes, cancers, all that stuff. But if you need additional coverage, which a lot of people do, you want a $10,000, $20,000 cancer plan or heart attack plan, Medicare says that's fine. You're okay. You can buy additional coverage. It does not interfere with your Medicare. Medicare does not pay to bury you or help you with any life insurance needs. So you need to take care of your life insurance with your financial planner and make sure that you're covered on those things, because Medicare does not pay that stuff. But the big one is number 4 here, the home care issue. Medicare might provide some general small home care assistance, but it does not pay for an assisted living home. It does not pay for somebody to come in and cook and clean for you, or to bathe you, or to help you go to the bathroom. Medicare only pays for skilled nursing rehabilitation. You get 20 days for free under most all plans, and then another 80 days for a fee, for a total of 100 days per incident. Now, you have a stroke and you get your maybe 30 or 40 days, you get some care. 2 years later, you fall down and have a bad accident, you get a new 100-day limit. But it doesn't mean you're going to get 100 days. You have to qualify for this care. So you definitely want to look at long-term care insurance, or making sure that you have enough emergency funds to cover your home care needs. So what are your next steps? Everything's a process. Every single thing is a process. You definitely want to pay attention that you give yourself some buffer. So you give yourself plenty of time. 3 months ahead of your retirement or 3 months ahead of your birthday, you want to start activating these benefits, because it takes the government about a month to agree to issue your Medicare information to you. Your ID number, it's an 11-digit alphanumeric code. That gives you 2 months to talk to your pharmacist, your doctor, to talk to Affordable Medicare Solutions, talk to your dentist, make sure you're getting the plan that works best for your providers. And then on your birthday or your retirement date, you're fine. There'll be no gap in coverage. You'll leave one work plan and you'll move into Medicare. It's not a problem. But even if you did that on September 1st, you want to do a review after October 1st, after October 15th, to make sure you're on the right plan for the next year, because we don't even know the new plans for next year until October 1st. So I know this is a recap, and I know you all understand that there's a lot of components to Medicare, but remember, there are 2 paths to take: either the new modern side of Medicare or the supplement side with the traditional classic Medicare. Both are great. Some sides are better for some people than others, so we'll go over that with you. Half of people now are using the Advantage system, and half are using traditional Medicare, and your decision is not permanent. Don't be fooled by some agents out there saying you're making a lifetime decision. You're not making a lifetime decision. That's just noise. That's just trickery. So don't pay attention to that. Medicare does not cover everything. You want dental coverage, you want to have cancer coverage, other stuff, long-term care. You need to buy those additionally. You want to review your plan every October 15th through December 7th, and then be aware that people that are low income or chronically ill get special plans and privileges. And also that means we can help them year round, not just during the fall season. We can help these special needs people year round. So I had to create this page to address the problem of Joe Namath and Jimmy Dynamite JJ Walker on TV. These guys hawking Medicare like crazy. I think Joe Namath is making more money today than he ever has selling Medicare. It's crazy. Joe Namath won't resolve problems with prior authorizations with your providers. Joe Namath is not going to help you with your drug exceptions and appeals. Joe's part of the scam problem. We help prevent scams. We'll review your annual notice of change. We'll shop your plan when you move or you have a special need. We'll help your adult children. Adult children love us. You need to tell your children, hey, I've got my car insurance guys over here, my financial planners over here, and here's my Medicare people. The adult children need help. If something happens to you, they need help because they don't understand this stuff. We help them daily. We explain plans benefits to providers, to doctors' office staff, because they don't understand. They're too busy and they don't understand all of these changes. We help people access their free extras like dental, vision, groceries, etc. We do a huge amount of education and updates by email, social media, and other methods. We help navigate provider network problems. You probably heard, these hospitals fighting with insurance companies. So every year without fail, we have to deal with provider exiting certain networks and things. It becomes a headache, but we know it's every year. We also have a free support team. Our client support team is 11 employees that are completely free to you year round. So our name is Affordable Medicare Solutions. We're in Suwanee, Georgia. We serve all of Georgia and most all of the United States. Our contact information is 770-945-5261, or simply you can email us at info@amsplans.com. We're here to help you. We know this is complicated, but hey, don't tune up your own car. Come to us. We're the Medicare mechanics. We'll fix it all for you, and we'll take care of you year by year, not set it and forget it. We are here to manage your Medicare. Thank you very much for spending time with me tonight, and let us know how we can help you.